Now, necrosis of the pulp. Necrosis is basically the death of the pulp. Necrosis may be the sequel of inflammation or it may occur as a result of trauma. So, there are 5 signs of inflammation. Sign of inflammation, and inflammation is followed by necrosis. Followed by necrosis. So the 5 signs of inflammation are rubor, that is redness, calor, that is rise in temperature, tumor, that is swelling, and dolor, that is pain. And now the necrosis that occurs as a consequence of inflammation. And there are 5 types of necrosis, that is coagulative, liquefactive, caseous, fibrinoid, and fat necrosis. So basically, in necrosis of the pulp, coagulative or liquefactive necrosis are seen, and it occurs as a consequence of ischemia of the pulp. So the cause of necrosis of pulp could be either bacterial infection or trauma or some chemical irritation. Chemicals could be like amalgam restoration, zinc oxide, eugenol, or any other dental material. So the bacterial infection will cause the inflammation of the pulp and further the necrosis or death of the pulp. So the necrosis of the pulp is categorized under dry gangrenous necrosis. Gangrene is a type of necrosis. So necrosis of the pulp could also occur as a consequence of trauma. Trauma could occur due to fall or some fist injury, etc. And the symptoms of necrosis: initially, necrosis of the pulp gives no symptom or it is asymptomatic. Later, discoloration of the tooth occur, like black or grey discoloration of the tooth occur, and it cause loss of luster of the natural tooth. And teeth with partial necrosis can respond to thermal change and it gives false positive test. So the pulp appears as alive or viable, but the pulp is actually dead. So it gives false positive test. And the diagnosis of necrosis of the pulp is accidental. It is come to know when we do radiographs for any other pulp pathology, or when we do routine radiographs. Generally, tooth appears normal and it gives no sign on radiographs, and sometimes large cavity or filling is present, and it will cause the necrosis of the pulp. And an open or closed apex could be seen on radiograph, and the tooth does not respond to cold stimulus, rather it gives pain response or on hot or cold beverage. On taking hot or cold beverage, response will give on hot or cold, hot food or beverage. And the treatment of necrosis of the pulp is pulpectomy or RCT.